See, more than 3,000 people died of opioid overdoses in 2017 and 2018 combined. Now, 400 of those were right here in Shelby County. Now, health experts are questioning whether there's a link between cold weather and increased drug deaths. Good Day Memphis anchor Kelsey Cairns explains it in tonight's local health alert.
There's a newly discovered threat contributing to the crippling crisis that is the opioid abuse epidemic. Mother Nature.
Unfortunately, we do see an increase in opioid or overdose-related deaths in the colder months.
A recent study conducted by Brown University explains that cold weather snaps contribute to more overdose deaths in the Northeast. But how about here in the Mid-South?
At this point, we don't have sufficient data to say there's a trend during the winter months.
While these stats show overdose numbers in Shelby County scattered across the board, around this time last year, the health department did record a spike in overdose activity. Dr. Dale Kreiner works in the ER department at St. Francis Hospital. He explains why cold weather may play a factor.
When someone overdoses on opioids, many times it's a lot of respiratory depression that occurs. In other words, they slow down and sometimes quit breathing.
He says when it's colder outside, that respiratory depression can happen much faster, meaning someone who suffers an overdose may lose the ability to breathe much faster. He explains seasonal or holiday depression could also be responsible for the increase in deaths.
As folks typically would gather with their families for holidays, sometimes individuals that have underlying mental health problems that also have a concomitant substance abuse problem, they tend to be more by themselves.
To help individuals suffering opioid drug addiction and prevent more overdose deaths, the health department explains there are resources available.
It's really important that people have access to Narcan.
Narcan is a nasal spray that can reverse an overdose. It is available at any pharmacy. If you see someone suffering an overdose or notice related symptoms like respiratory distress, call 911 immediately. Kelsey Cairns, Local 24 News.
Now, if you or someone you know is struggling with addiction, you can call the Tennessee Red Line. That number is on your screen, 1-800-889-9789.